My name is Martha Mayo, and I am presenting my case study for Level 1 Fieldwork. Setting the stage. Who was patient X? What was an inpatient evaluation? When was April 6th for 25 minutes? Where was Baptist Memorial Hospital, DeSoto? And how was a co-evaluation by both occupational and physical therapists? Before entering patient X's room, the chart revealed that he was an 82-year-old African American male who was admitted to the hospital following a fall that resulted from a CVA. His stroke affected the left side of his brain, and he now suffers weakness in his right arm, hand, leg, and foot. His prior medical history includes hypertension, diabetes, prostate cancer, status post radiation, and hernia repair. When patient X describes his situation that brought him to the hospital, he says, I woke up and got out of bed and fell. Realized I couldn't move my right side and tried to tell my wife to take me to the hospital, but she said she couldn't understand me. She took me to the hospital and they said I had a stroke in my sleep, and that's why I fell. During his evaluation, we found that patient X lives with his wife. He is now retired. They live in a single-story house with one step to get inside. They own a tub shower combo that he had no trouble stepping into. And he owns no medical equipment outside of both dentures and glasses, which he wears daily. He was completely independent prior to his hospital stay. The testing revealed that he was significantly weaker on one side due to his CVA. His upper and lower body dressing were impaired, shown by his inability to don a hospital gown or put on socks. His bed mobility was a minimal assist, meaning he could only complete 75% of the task himself, and his proprioception was poor, as he was unable to locate his nose or touch the therapist's finger. His gait was poor. He walked 12 feet and fatigued very quickly. He could not grasp the walker on his affected side, and he was a mod of 2, meaning that he could only perform 50% of the task and needed at least 2 caregivers present for safety. He experienced impaired sensation on the upper and lower body during light touching, saying the sensations felt different on each side, but his altered mental status was lifted because he was oriented by 4, knowing where he was, what happened, the year, and his name. We ended our evaluation recommending inpatient care for patient X because he would have a mandatory 3 hours of therapy a day to include speech, physical, and occupational therapy. As of Friday, April 8th, we learned that he was accepted and insurance agreed to pay for an inpatient stay downstairs for 2 weeks. Although we did not get to the intervention stage as I was only in inpatient care, my goals for therapy would be strength, fine motor, and proprioception. I would choose activities with equipment similar to the arm arc on the right and the clothespin activity photographed on the left. Both work on grasping and manipulation of the pieces, fine motor, finding the piece and placing it in a particular location, proprioception, and strengthening. These would help improve function and independence because the goals would transfer over into everyday tasks, such as gripping a fork and finding his mouth to place food, and Rom on his affected side to lift his arm over his head to put on shirts. Collaboration. To get patient X back to his independent lifestyle prior to his hospital admittance, we would need collaboration from the staff and his wife to help him regain function. Nursing staff and PCAs need to encourage him to use his affected side, even if it may take longer. The physical therapist would work on his gait and poor endurance using a hemi walker or handheld assist to keep his hand on the rolling walker, and his wife would have to resist the urge to complete tasks for him and constantly praise his efforts. Promotion of health and participation in life. After patient X reaches his goals for inpatient stay, he will be discharged to return home to his wife and family. We would work with case managers to have insurance purchase a shower bench for safety in the restroom and proper walking equipment. Upon discharge, the case manager would determine whether he qualified for outpatient or home health therapy to continue to get his independence level prior to that of his stroke. Thank you.